Obstructive sleep apnea is an independent factor for the stroke. It is independent for the sex, body mass index, diabetes, hypertension, hypothyroidism, acromegaly, and chronic renal failure. This obstructive sleep apnea characterized by excessive daytime sleepiness, chronic snoring with witness apneas. So these type of chronic obstructive sleep apnea patient may collapse suddenly and having stroke and paralysis of the limbs and sudden death are common in these type of the patient. So any patient who present with excessive daytime sleepiness, chronic snoring and witness apnea should be go for further evaluation.